The first steps to take in order to intervene for a patient with a low blood pressure is to immediately assess your patient. Hello everyone, welcome back. My name is Leah and I create nursing-based content here on YouTube. I post every Thursday, so if you are simply intrigued by the field of nursing, this channel is for you. So be sure to hit the subscribe button so that you can be a part of the Nurse Collective family. So on today's video, I would like to talk about hypotension, and how you as an acute care nurse should intervene when you have a patient who is experiencing hypotension. So before we talk about hypotension, we need to understand what blood pressure is. Blood pressure is defined as the pressure of blood pushing against your arteries. Arteries are blood vessels that carry blood from our heart to the rest of our bodies. So our blood pressure is vital in regards to us living as human beings. When you look at a blood pressure, or when someone tells you what their blood pressure is, it normally is a top number and a bottom number. So for instance, the common blood pressure or a normal blood pressure value is 120/80. That is textbook, 120/80. When you look at that, the top number is the systolic blood pressure, and that is the top number. The systolic number, or the top number, is the larger number. Systolic pressure is the pressure of the arteries as the heart pumps out blood during each beat. The diastolic number is the bottom number, and this number represents the pressure as the heart relaxes before its next beat. Again, it is the smallest number. Hypotension is a measurement in a blood pressure that is below 120/80. But this measurement can differ in regards to patients based upon their medical history or things of that sort. When we talk about hypotension is a measurement in blood pressure that is lower than 120/80. So hypotension can be defined as the pressure of blood circulating around the body that is lower than normal. And when we think about this, you think about the fact that arteries are supplying blood to the rest of our bodies. That means that your vital organs are not getting adequate enough amount of blood, which can cause various signs and symptoms. You think about the symptoms that can actually result from a patient experiencing hypotension. The typical signs and symptoms of hypotension involve dizziness, lightheadedness, fainting, feeling nauseous, vomiting, having distorted or blurred vision, fatigue or weakness, confused, sluggish. These are the common symptoms that you will basically experience when someone is hypotensive. In some cases, some patients will state that they don't feel any kind of symptoms, but you can notice that there is a difference in their measurement of blood pressure. And because of that, you still need to intervene, even though they are asymptomatic. When you get onto the floor as a nurse, typically when you are in a med-surg facility, patients are getting vital signs every 4 hours. Sometimes it can be 8, but typically it is every 4 hours. If you are in a floor that has CNAs, the CNAs will be obtaining the vitals. And so you as a nurse could be doing anything that you may be doing on the floor, maybe looking through a patient's chart, maybe with another patient, and you get a notification either from the CNA via phone, via however way they may message you, and they may say, hey, patient in 801, it has a blood pressure of 89/30. In that case, we're going to talk about the steps that you need to take to make sure that you are intervening properly. So in my hospital, there are standing orders that the doctors have set up that notify us or signify for us to reach out to them so that we can intervene on regards to a patient with a low blood pressure. Typically, intervention in my hospital for a low blood pressure is anything less than 90 for the systolic, and for the diastolic, anything less than 50. So when we see a blood pressure that has anything less than 90/50, we are immediately intervening to make sure that the blood pressure is going up. The first steps to take in order to intervene for a patient with a low blood pressure is to immediately assess your patient. When you're working in an acute care setting, as a nurse, you are mostly taking care of between 4 to 6 patients, God forbid 7. But when you are doing that and you are notified of a low blood pressure of a patient, no matter what's going on, you are to stop what you're doing and to immediately assess the patient. When you go into the room and a patient has a low blood pressure, the first thing you need to do is assess the patient to understand what signs and symptoms they may be experiencing. Again, we already stated the common signs and symptoms that you will see with a patient with hypotension. The next thing that you need to ensure is the patient's safety. For instance, we already went over what some of the signs and symptoms of a low blood pressure could be, as far as fainting, dizziness, confusion. So if they're walking around aimlessly, just doing all kinds of things, and they're stating that they feel lightheaded, if they are confused, the first thing you need to do is make sure that patient is sitting down. Sitting down and someone is there monitoring, such as yourself, or if you need to go grab something else, make sure someone else is making sure that they are sitting down, putting on their bed alarm. So assess the patient. assess them for the signs and symptoms that we have already stated, and to ensure the patient's safety. Once you are done, the next thing you are to do is to assess to make sure that the blood pressure cuff is an adequate size. If you have a blood pressure cuff that is too big or too small, it will cause you to have either a high or low blood pressure. So ensure that the blood pressure cuff is an adequate size. Next, you want to obtain a new blood pressure if you notice that the blood pressure cuff is not the adequate size. If the blood pressure is still low, then the next step will be to obtain a manual blood pressure. This will probably have been the first skill that you probably do in nursing school. So get a manual blood pressure, get your stethoscope, have the patient sit down, have them relax, and take the blood pressure again. If the blood pressure is still low, again, assess the patient's signs and symptoms. Immediately notify the doctor. You can notify the doctor via call, via page, or via secure messaging as we do in our hospital through Epic. Let the doctor know who the patient is, a little bit about the patient, and give them a full set of vitals, as well as address and tell them their signs and symptoms. That is typically what I do when I am reaching out to a doctor in regards to a patient with a low blood pressure. It's typical interventions in regards to a patient with a low blood pressure will be to give a bolus, will be to ask the patient to basically increase their fluids as far as water. Once the intervention has been given to the patient, for example, the bolus, you are to take the blood pressure immediately after to ensure that the blood pressure has went up. If the blood pressure still doesn't go up, assess the patient's symptoms, notify the doctor, and do it all over again. So this is typically the step that you take when you have a patient experiencing hypotension. I was a little overwhelmed as a new nurse because I was like, oh my gosh, I know what hypotension is. I know what I would see, but what do I do in order to make sure that this patient comes back to their baseline? And so it could be a little overwhelming. And so I wanted to create this video for you all who are starting out on the floor, who have so much information and so much knowledge, but the day-to-day task of taking care of patients really was not addressed or given to you either through clinicals or through nursing school. So this video is for you guys. Be sure again to hit the subscribe button. So talk back to me. Have you experienced a patient with hypotension? Did you follow any of these steps? If you have any extra steps, put them down in the comment section so that we can talk back and learn from each other. You guys, nursing is a wonderful field, and I know that there's so much that we have to learn. And so my job and my goal is to make sure that this journey in nursing is as smooth as possible for you all. So be sure to hit the subscribe button, and I'll see you guys next Thursday for another nursing video. Bye.